Good morning, everyone, and welcome to the eQHealth Provider Portal demonstration. My name is Stephanie. I'm a corporate trainer here at eQHealth Solutions. Everyone is in listen-only mode right now, but I will be unmuting everyone at the end for any questions. So what you're seeing on my screen right now, this is the Provider Portal self-registration website. I included the website in the chat box of your go-to panel as well. So the very bottom of your go-to panel is the chat box, and the link for the registration site is in there. The first person in your practice to register for the portal will automatically be considered the system administrator for your practice. Now, this is the person that's going to be in charge of creating and managing all the user accounts within your practice. For username, we do recommend using your email address as a username because it is more unique. It's also easier to remember. Password requirement, at least 8 characters in length, with one of those being a special character, for example, the @ symbol. All required fields have a red asterisk. So your name, your practice name, provider information, including the provider's NPI, as well as the first 9 digits of the Medicaid ID number. So you'll click Submit. Once all the required information has been completed, click Submit, and you'll receive a confirmation email. So follow the steps in that email to activate your account. Then the system will take you over to the main login page. I'm going to switch over to that now. And just to make everyone aware, this is our training site. So from this main login screen, you're going to enter your username and the password that you just created, and either hit enter on your keyboard or click this blue login button. So what you're seeing here, when you first log in, the default screen, this is the main dashboard. You have a menu bar here at the very top, 4 tabs here on the left, and 3 over here on the right. So I'll start with the top. The Authorizations button, this is your home screen. So from wherever you are in the system, clicking Authorizations will bring you back to this main dashboard. Admin, system administrators will have this admin tab. And again, your system administrators are the ones that oversee creation of all the user accounts within your practice. There are 2 tabs underneath the admin. One is Practice Admin. Practice Admin lists practices that your account is associated with. The other one is User Admin. So as administrator, you can see all of the users that are associated with your practice. If there are a lot of users in your practice, you can use this filters button here in the top right corner to locate a user account. You can click a user to add or remove practices, denote whether or not the user is an administrator. In the event that the user needs to reset their password, admin can push a password reset email to the user. You can also have more than one administrator in your practice, but you'll have to create them first. So what we're going to do here is we're going to add a new user. So add new user in the top right corner. You'll see that there are 2 bars at the top, the user info and the demographics. And right now there's a red X next to each one. As you complete the required fields, both of these red X's will turn into green check marks. So you're going to enter the user's email address as well as a username for them. And again, we do recommend using email address simply because it's easier to remember and it is a more unique username. Then you're going to select the practice. Select the practice that the user will have permissions for and whether or not this user is going to be administrator. You can enter their NPI number here at the bottom. The new user, moving over to demographics. Well, once all the required information for user information has been completed, you see the green check mark. So we can either click next in the bottom right corner or simply click the demographics section header. Complete this information, their contact information, name, address, telephone number, and click create. Once you click create, the new user will receive a system generated email containing a link for them to set their password. And once that new user sets their password, they can log into the system and begin using it. Now we're still in the top menu, My Profile. So My Profile, all users have this functionality, My Profile. This will allow you to update your email address and change your password, as well as your demographic information, and if you need to add your own NPI number, if you need to add an additional NPI number. I do want to point out that if you, whatever changes that you make on either one of these screens, be sure to click Update in the bottom so that the system does recognize that you have made a change. I do like to stress on the importance of correct email address just for a second. Correct email address is very important because system-generated emails will go to the email address that is provided for a user. So your email address that is entered in this field. So those system-generated emails, for example, account activation, new account notification, password recovery, notification of case status once the case has been completed, request for additional information. All of those system emails will go to this email address. So if your email address ever changes, you want to make sure you come to this section, correct your email, and be sure to click Update to save those changes. And then finally, here in the top, Help will allow you to enter a help ticket to our customer support team. Click the Submit Help Ticket button to open a technical support form in a new window. All required fields are indicated by the word required. In this free text box, you'll enter a description of the issue or the problem that you're having. Here where it says attach, you can attach a document or a screenshot to your ticket. And we do recommend submitting a screenshot, especially if it is an error message, because the first thing that our customer service is going to ask for is a screenshot. So it's always best to go ahead and include one if you can. Once you complete everything, click the Submit button to send this ticket to our customer support team. You will receive email confirmation that your request was received. Once completed with this, you can simply close the technical support form window. And I'm going to get back out to my main dashboard by clicking the Authorizations button here at the top. Okay, so I'll go through the 4 tabs over here on the left. The first one is Action Required. And this is also the default screen after you log in. Any cases that are sitting under Action Required, these are requests that your practice has submitted. Clinical staff has reviewed them on the back end. Further information is needed in order for them to render a determination. So you can click anywhere on this highlighted line to open that case. And it opens into the Notes and Detachments section where you can see what information has been requested. And the most recent note is always at the top of this list. If there were any documentation that had been uploaded via the provider portal, it would display here at the bottom with a green check mark. So to respond to this request for documentation, we're going to click the Add Notes and Attachments button. So either an attachment or a note is required in order to submit this case back to clinical staff. If you're going to upload a document from your computer, click Choose File. Select the document from your computer. Once it is ready for upload, once it has been uploaded, it will display a check mark beside it. Again, either an attachment or a note, and then click Save and Continue to submit this case back to the clinical staff member. There are 2 other tabs that you can use to review information in this case. One of those is Letters. So any letter that is generated for a case will be seen under this Letters tab. And you can click the name of that letter. It will open in a PDF window for you. These letters can also be printed if you need to. Summary tab gives you a summarization of all the information entered for this review. The case history here in the top right corner will show you, so for example, a request that has multiple reviews, maybe an extension or a reconsideration. You can click on these, either one of those to review the summary page for that review. Okay, and then the Actions tab here in the far right side of the case. This has different functionality based on the status of the case. And you can see which options, which functions are not available to a case because they're gray, and you simply will not be able to select them. So create fax cover sheets. What this is, the fax cover is preloaded with provider information that we have in our provider files. So you don't make any necessary changes to this and click the Create in the bottom right corner of it. What this does is it creates a customized fax cover sheet with a barcode here that is specific to this patient and this patient alone. So if you're using this fax cover sheet to fax documentation to us, then our system will read this barcode and will attach this documentation directly to your case. Okay, the next under Actions is Print Summary page. So this entire page that you see here, the summary page, if you needed to print this for your records for any reason, then you could, under the Actions tab, Print Summary page. Create New Request will populate all information from this current request, and all you would have to do is change anything that is different. So a little efficiency for you. So you wouldn't have to go search for that member. You would just simply change anything, maybe providers, dates of service, whether it's inpatient or outpatient, for example. Request extension, so you can request an extension if this were a completed case. Cancellation, if the status of the case is in progress, you can request cancellation. You can either upload an attachment or type a message in this free text box. Now there is a pre-populated message here to please cancel this request. Save and continue. This will send a message back to the clinical staff or those reviewers where they will cancel the review for you on the back end. Okay, request reconsideration. So if this case had been denied, this is where you would be able to request your appeals, fair hearings, peer-to-peer, or reconsiderations. And had this been a completed inpatient case, then you would have the option to enter a discharge date here, and I will show you that shortly. So I'm going to go back out to my authorizations, my main dashboard. Back under the action required, you'll see the case is no longer sitting here, and that's because I responded to that request for clinical, that request for supporting documentation. The case is now under the Submitted tab here. Okay, it's under this tab. Its status is in progress, and it's sitting with those reviewers, waiting to be reviewed for determination. So while I'm on the Submitted tab, I'll talk about it for a second. So everything under the Submitted tab, these are requests that have been submitted by your practice. Every one of these are sitting with the reviewers. Determinations have not been made. Case status for every one of these is in progress. The Completed tab will show cases that have been reviewed by clinical staff. Determinations have been rendered. See, the case status column will be certified in total, partially certified, not certified, or if in fact it had been canceled. We also see an additional column here off to the left, Extend. So this is another area that you can request for an extension. So information, so clicking on the plus sign, information from the current request will preload. You would simply enter the new information, the new ending date, diagnoses, procedure codes, for example. Okay, and not all of the cases have the plus sign. This option is only available for those that have either been partially certified or certified in total. For example, the discharge date. If a patient has been discharged or a service has not been certified, then you will not see the option to add the extension. So that's why you only see the plus sign on some of those cases. Okay, clicking on a case is going to give you those same three tabs that I just went through, the summary, the notes and detachments, and the letters. So on this completed review, I'm now going to click on the Actions tab. You see, I now have the option to request an extension here and reconsideration on this one. And let me come back out. And on the completed inpatient, I now have the option to enter that discharge date. Okay, so putting in the discharge date, the system requires the actual date of discharge as well as the discharge disposition. Save and continue. If you're trying to enter a date that is outside the date range that was reviewed, you're going to get this red error message that you see here. And that's because the system is recognizing this date or dates as not being reviewed. So it's not a covered day. What you'll be required to do is to enter an extension request in order for that date to be reviewed and determination made. Then you'd be able to enter that discharge date. Okay, I'm going to go back out to the authorizations. The last one is drafts. So this is the drafts tab. All cases under here, these are cases that have not been submitted for review yet. So maybe you needed another code, or you needed to gather your documentation before you completed a request. These are all just saved in draft status. You will notice an X to the left of these. This is the only area where a a review can be deleted. So if it is a draft, drafts are the only ones that can be deleted. So click the X from this main dashboard, or from within the review itself. You do see the delete button here, and it does remind you that authorization requests can only be deleted while in draft. Okay, it is important to note any case under this draft section, these will not be seen by your clinical staff or any of those reviewers. Those reviewers will only ever see these requests once you've clicked the submit button and the status is in progress. So if you're wondering about status of a case and you can't seem to find it under these other tabs, completed or submitted, come take a look at the draft tab. Make sure that the case is not sitting here. You also want to check under the action required tab as well. So the goal as a provider is to not have any cases sitting under draft or action required. And that's why both of those have a number beside them. It's a way of saying, hey, you have something here that doesn't need to be here. So come take action on this. Come complete this. Take care of this information. Okay, now I'm going to go through these three tabs over here on the right. So the filters tab, you can use multiple filters to search for specific reviews. So you can filter by the member name, case number, authorization number, servicing provider, service type, inpatient or outpatient, service date. There's also a filter. If your account is affiliated with more than one practice, you'll be able to filter by practice as well. Anytime you're adding a filter, be sure to click the add button. And additionally, under the completed tab, you also have another filter, and that is the discharge date. So if under the completed tab over here, you can filter by the discharge date as well. And again, when you're applying a filter, just click add. So you can use as many or all of the filters as necessary to locate a review. And then to remove the filters, just click the X next to each one. Okay, the export to Excel. So you are able to export either of these four tabs over here on the left. For example, maybe you want a paper copy of your outstanding request, your in progress request, so you can export that to Excel. So again, either of these tabs can be exported into Excel format. So new request. New request is where you're going to be entering your new request. You're always going to see these three tabs here at the top: Request, Clinical, and Finalize. And the highlighted tab is the one that we're working on right now. Once we complete information for this section, then the system will move us over into the next one. If you're associated with multiple practices, you'll need to select the correct practice from a drop box that would be here. If you're only associated with one practice, then the system will default for you. You won't have to select it. So here we're going to click Find Patient. So the system has specific search requirements. You're always going to need a date of birth, but in combination with either a first name and a last name or a member ID number. And you can hit enter on your keyboard or click the blue search button. A list of patients that meet this search criteria will display here. So you're going to click anywhere on this line to attach this patient information to this request. If you had selected the incorrect patient, here where it says change patient, you can click that and it's going to open up those search parameters again so that you can search again either by birth date, first name, last name, or birth date, member ID number. The patient's health plan information is populated here. This is hyperlinked. You can view this information in a PDF window. Type of service, you're going to need to select whether this is for an inpatient or an outpatient service. And because there are different data points required for both of those, I'll do one of each so that you can see. So I'm going to do an inpatient review first. For inpatient, you're required to enter your starting and ending dates. So your date of admission, anticipated discharge date, the number of days is calculated for you. You'll need to select whether you are the ordering provider, the servicing provider, or both. And what this does is it helps to narrow down your search parameters. I'm going to select myself as the ordering provider and click Find Ordering Provider. So because I selected myself as ordering provider, I can simply click search, and only providers associated with my practice or my ID are going to populate here. So I don't have to go search for myself. Servicing provider, click Find Servicing Provider. You can use any or all of the search fields. Okay, the more information you give the system, the more narrow your results will be. Okay, for category, you're going to select, is this for inpatient hospice, an inpatient hospitalization, or a transplant? Place of service uses the CMS inpatient places of service. Request severity always defaults to standard, but if this is an expedited review, you can manually change that. Treatment type is either medical, surgical, or mental health. And level of care will be acute, critical, skilled nursing, rehab, for example. And then save and continue. Once you've completed all of this information, save and continue, and that will move us over to our next section, the clinical section, where you can enter your diagnoses, procedures, upload your documentation, enter your clinical notes, and you can see that that tab here is now highlighted at the top. So for diagnoses, you can either type the description of that diagnosis or use the ICD code, but without using the decimal. You can enter more than one diagnosis. The first diagnosis that you enter, the system will default it as the primary diagnosis. If you need to select a different as your primary, then you're going to click the bubble, the button out to the left of it, and that will make it the primary diagnosis. Should you need to remove a diagnosis, then click the X here to the far right. This will put a strike through this diagnosis. So until you click this save and continue button, then you have the ability to undo this. So for example, oh, I needed to use that code after all. You have the ability to undo that. But until you click the save and after you click the save and continue, then you'll have to come back and manually search for that diagnosis. Procedures works the same way, either by typing the description or by using the procedure code itself. For inpatient procedures or services, the start date will default to the date of admission that you entered over here on the request page. But you can change it if it is scheduled for a different day. Okay, again, you're either going to upload an attachment or type out a clinical note. Again, if you're going to upload from your computer, click Choose File, select your documents. Once it has been uploaded, then that check will appear. You can type your free text here. Sorry. Okay, then save and continue. Save and continue brings us to our third tab here, Finalize and Submit. I just want to point out that this is still a draft. So you see here in the top, delete and draft. So again, so it says finalize, but we're still in draft. We need to review this summary page for accuracy. Okay, make sure everything is accurate. If you do find anything that you need to edit, then you can always click the tab at the top to jump straight to that section. But once you do make changes, remember to click the Save and Continue button so that the system will recognize any change that you made. Okay, once everything is accurate, then you're going to click the Submit button here in the bottom left. Submit will put this case into an in-progress status. So once you click Submit, you'll notice that you now have a case number. The case status is in progress. Okay, there are 4 things that you can do from this screen here. So create fax cover sheets. What I showed you from the Actions tab, that customized fax cover sheet, you can create that fax cover sheet here. So if you're going to be faxing information instead of uploading it, again, here's where you can create that fax cover sheet with that personalized barcode that is specific to this patient. Create new auth for a current patient. So if you want to create another authorization for the same person, then you can click that link here. System will pre-populate information from this current request, and all you have to do is change any information that is different. Return to dashboard. This is the same thing as clicking the authorizations button in the top. And then the print in the top right corner. So this summary page, this is a secondary if you wanted to print your summary page immediately after submitting an authorization. Okay, so I'm going to click Authorizations and come under my Submitted tab, and the inpatient request that I just submitted is here, and case status is in progress. Okay, so now I'm going to do an outpatient request. And so new request, find patients. Search parameters work the same as before. So always going to need a date of birth, but in combination with either that first and last name or the member ID number. So for the inpatient review, I used first and last name. So for this one, I'm going to use their member ID number. Oops. Oh, I see. A little dyslexia this morning. Here we go. Okay, so the patient that meets that search criteria displays, you're going to click anywhere on this line, attach that patient information to the review. Plan population still, plan information still populates here. You would click this to view that in a PDF window. So this time, instead of selecting inpatient, we're going to select outpatient. Okay, so for the outpatient, you're required to enter only the starting date. You'll be able to put in your unit frequency duration on the next section, the clinical section. So for our start date, okay, so again, are you the ordering provider, servicing provider, or both? I'm going to select myself as ordering provider again. So find ordering provider and search, and it's only going to locate myself. If I selected servicing provider, then I would need to search for that servicing provider. Okay, find servicing provider. Again, the more information that you tell the system, the more narrow your results will be. Okay, you're going to click anywhere to add that provider. If you have added the incorrect provider, you can click out to the side, change ordering or change servicing provider. The same search fields pop up for you so that you can search for that correct provider. Okay, so categories for outpatient. Categories for outpatient, D&E, general outpatient, hearing, home health, hospice, or private duty nursing. Okay, so you're going to select your category. Place of service this time uses the CMS outpatient places of service. Request severity continues to default to standard, but you can change to expedited should this be an expedited request. Save and continue moves us over to our clinical section, again, where we put in our diagnoses, procedures, documentation, and our notes. And you see that tab is highlighted. So the same as before with the inpatient review, searching for your diagnosis works the same way. So either type out that description or use the ICD code, but without that decimal. You can add multiple diagnoses and select which one is primary. You can still remove a diagnosis. For procedures is what's a little different. Okay, so for an inpatient required a start date only. Outpatient procedures or services requires the unit frequency and duration. Okay, so if your frequency is total, okay, if your frequency is total, then you'll have to come over and either type in a date or use your calendar button to provide a window. So whatever your per Nebraska Medicaid, whatever your policy, whatever your procedures are for that window for outpatient services, you're going to manually apply that date here. For any frequency other than total, for example, per day, per week, per month, or per year, then it's going to open up the duration field where you can type out the number of weeks, days, months, or years. The system will calculate that total number of units as well as the service ending date. Okay, so again, either an attachment or a note is required. All right, have a little, there we go. Okay, and then save and continue. Save and continue brings us back to that third section, finalize. Again, reminder, we are still draft. Okay, so you're reviewing the summary page. Make sure that everything you entered is accurate. If you do find something that you need to change, you can go back to that section. But if you need to change anything, be sure to click the Save and Continue button here at the bottom so that the system recognizes those changes. Once everything is correct, then you're going to click the Submit button again. And once you click the Submit button, right, again, we have that case number. The case status is in progress. The same functionality as before, you can create that customized fax cover sheet with that barcode specific to this patient. So again, if you're going to be faxing documentation instead of uploading it, then you'll use this. You can use this fax cover sheet. Create new auth for current patient. Populate everything from this current request. All you would have to do is change anything that is different. For example, is this inpatient or outpatient? Category, procedures, diagnoses, for example. And then you can return to dashboard. Again, return to dashboard is the exact same thing as clicking authorizations. And then this print in the top right. If you want to print your summary page immediately after you create the authorization request, you can do so here. Okay, so I'm going to return back to my dashboard, and again, the outpatient request that I just submitted is sitting here under Submitted tab. Case status is in progress. So I'm going to click it and go into it. So if you look into this case and look at their banner here in the top left, right, we see a case number. We see the case status is in progress. And then the authorization number over here, authorization right now is not assigned. So the system will only assign an authorization number once a case is either approved or at least partially approved. So I'm going to unmute everyone in case there are any questions regarding portal functionality. We also have Jessica Roth on the line with us in case there are any, in case you have any questions regarding Nebraska Medicaid health plan questions. Okay, so everyone is unmuted in case you have any questions.
All right, Jessica, would you like to say a few things from the Nebraska standpoint?
Oh,
Jessica?
Yep, can you guys hear me?
Yes.
Oh, perfect. Okay. I just wanted to say thank you guys for all registering and taking the time out of your day to become familiar with how to submit requests through EQ. I know it is a transition and it is a change, so I appreciate your guys' patience and your assistance in getting this as smooth as possible. If you do have any questions, EQ is more than happy to help answer those as well. Their toll-free number is 888-498 0939. And then on the state side, you can always reach out to myself for the contract manager here at the state, Paula. Our email address to reach us is dhhs.mltc Utilization Management at nebraska.gov. If you do have any further questions, we do have a provider bulletin released. It's Provider Bulletin 2034. You can reference there. And again, if you have any questions, you can reach out to either EQ or us here at the state at that mailbox. Thank you, guys.
And we do have a question, actually 3 of them, but I believe that's all related to the same thing. They would want to know whether or not this is related to any managed Medicaid programs, but Jessica confirmed, I believe this is only for fee-for-service, correct?
Yes, wonderful question. This is just for fee-for-service.
Yeah. And then one other thing I wanted to make mention, this is Ashlyn from EQ, is to piggyback on what Stephanie said in regards to the beginning and end dates for the inpatient stays. If you are approved from 1/1 to 1/4, you are always look at the days because you are only approved for 3 days. The date of discharge or the date of anticipated discharge is not a covered day of benefit. So always remember that so that when you're doing an extension, you're requesting the correct amount of days. Any other questions? All right. Also, just wanted to let everyone know we have some little videos for training purposes. It takes individual pieces of the portal into smaller, shorter videos for how to do something in the system, whether it be entering an authorization, checking the status, uploading a document, that sort of thing. They will be posted through the Nebraska Medicaid provider bulletin as well as for the links for you to access. So if you have any questions, feel free to address or check out those videos. We were recording this video, so this will also be posted to the Nebraska website and the provider bulletin board for you as well for access. Or you can reach out for any questions to us at EQ. Stephanie or myself, Ashlyn, will be happy to answer any questions that you may have. All right. If there are no further questions, then we will give you back some time in your day.
Thank you, Ashlyn and Heather.
Thank you.